importance of health insurance at this time. And I know there's a lot of misinformation, misconception about insurance generally in Nigeria, and most importantly, health insurance. And so what is the point of having conversations on radio if we cannot properly educate you on these concepts, especially as it concerns your health and well-being? Mr. Richard Olalekun-Anigilaje, I don't know why I said Mr., but then Richard Olalekun-Anigilaje is with us in the studio to talk to us about health insurance. Good morning and thank you for being here, Richard.
Good morning. Thank you for having me always.
Of course, it's a pleasure. So, just so you know, there's an ever-increasing cost in healthcare in Nigeria, and there's a prevalence of ailment and diseases, and so health insurance has become a necessity. And studies that are being conducted, surveys that are being conducted, shows that we have a very low percentage of the country's population that currently have health insurance policies. So at the end of the day, after this conversation, we want to ensure that quality, affordable healthcare is the foundation of every individual, and how you can attain this quality healthcare without overspending, being looked after, taking care of yourself is what we're hoping to achieve at the end of the day. So, Richard, like I said, the rising cost of healthcare in the country is not a joke anymore, right?
Sure.
And especially now that there's disease outbreak and even the lifestyle choices of certain individuals, the smoking, the drinking, amongst other things, you can tell that they probably would struggle a lot with their health in the future. So health insurance is very, very important for people like that. But before we start to tell people all the complexities of health insurance, if any, what exactly is even this health insurance that we're talking about?
All right. I want to explain in a layman language.
Yes, please. Would appreciate that.
That you understand. Health insurance is a type of insurance that covers the whole or a part of the risk that the person is taking when incurring a medical expenses.
Okay.
Do you understand? Like, okay, I want to access healthcare, but I don't want to pay a whole lot. So I need to seek the help of the insurance company before the actual time I want to access that health facility. That, okay, I want to start using so type of facility. What can I pay annually? Then the insurance company will tell you, or the HMOs, they will tell you, this is the amount you pay annually. So it doesn't matter if you go there 1 million times in a year. So far you've paid your premium. A premium is the amount you pay for insurance. So far you've paid your premium annually, you can access that health care facility, and they will treat you to the tune of the benefit that is attached to the package that you choose.
So basically, this is just money that you pay to ensure that whatever health condition you suffer from, you will be taken care of.
Yes.
And the money that will be paid to take care of your health condition is dependent on the kind of policy or package that you have picked up for yourself. So basically, your health is covered as long as it is within the range of the benefits attached to the policy you have picked up.
Yes, sure.
All right then. So there are different types of health insurance policies. I'd like to believe that maybe based on the amount of people covered, maybe the kind of premium that will be paid amongst other factors.
Yes.
So what are the different types of health insurance available?
Okay, for individuals, you can take up the health insurance that, okay, just me alone.
Okay.
Then they will tell you the amount you are going to pay. Okay, I want to have a dependent also. They will attach an amount to it.
When you say dependent, somebody attached
to me that I know.
Does it have to be family?
It doesn't have to be
Anybody.
family. Anybody.
Okay.
It depends. So you tell the person, I want to attach this person. But there is a limit to the age that you can attach the person. Like a certain age. If the person has exceeded that age, you can't add that person as your dependent.
We will do that when we talk about conditions for the policy, so we don't jam up the conversation. So please go ahead.
All right, so there are different packages. Like, okay, if I have so type of ailments, this is the amount I will pay. Then the ailments also, they differ to the policies. There are some ailments that does not cover a certain package. Do you understand? So there are different types. Then for the family package, you can have your spouse, yourself, then children. For some packages, there are numbers of children you can
if you have 70 children, that's a different package.
You will now pay extra.
Okay.
If you are adding other children.
All right.
So like that, there are a lot of packages, and for critical conditions too, there are different packages. So I don't want to go into details so that I won't start advertising for.
I understand. So basically, the types of insurance packages available is contingent on the amount of people that are covered and also the severity of ailment or the ailments that you want to cover. So if it's just 3 people, maybe you, your husband, and your child, is a different package. If it's you, your husband, and 70 children, is a different package. If it's you and a dependent that does not necessarily have to be family, is a different package.
Yes.
All right, thank you very much for that one. So let's talk eligibility. Who can get a health insurance policy? What factors do they consider before you are allowed to pick an insurance policy, a health insurance policy?
Everybody can get health insurance. In fact, you know that there is a law in Nigeria that is mandatory that everyone in Nigeria should be covered. But most of us, yes, most of us, this National Health Insurance Scheme,
right,
has been, passed into law that everybody should have it. Research has shown that just 3% of Nigerians have health insurance, which is very bad.
Okay, my honorable minister.
And most of these people that are covered are being covered through the employers.
Right. It wasn't a personal.
Not a personal. Hardly can you find a Nigerian that says, okay, I'm working on my own, or I just want to get health insurance for my family and myself, except if it is their HMO through their companies. You see, it's very bad, and that is why we keep having a bad state of health facilities and all that. Because if a huge amount of Nigerians can access or are taking advantage of this National Health Insurance Scheme, and they are trying to access it, the government will see that, wow, we have a lot of people to attend to. Then there are a lot of facilities. They will feel, okay, this place is congested, let's build another. But when the facilities are there and people are not going to access it, then do you know there is a fund that is being pushed by the federal government to this National Insurance Scheme? That just a little amount you need to pay annually. That is for the federal government. Then we have states that are also, like, I know that Lagos State has their own health insurance scheme. That anybody, doesn't matter if you are a Lagos State worker, you can access it. And you can, buy the policy and you are covered. Can I say the ridiculous amount for individual?
How much?
A year, 6,000.
6,000 naira annually.
Imagine.
To access the health insurance, the state health insurance.
But
scheme.
If you want to increase it, there is other. But just for you, why can't you? Do you know that if you fall sick, the drugs you are going to use alone can be up to like 10, 15K. But when you keep going there, because you have paid your health insurance this thing annually, you can access the facility for the whole year. In fact, the funnest part is Lagos, they made it very, very easy for Lagosians, that you can pay monthly, you can pay quarterly, you can pay
in installments for the 6,000.
But if you are paying installments, it will increase.
It will increase, okay.
Because you are not paying. But do you know that the family package for yourself, your wife, and 4 children, 40K in a year? Can you see how cheap?
So insurance is not expensive.
It's not expensive.
Okay.
Except for critical conditions.
I can understand the exceptions. Yes,
there are some exceptions. Some critical things that they will not cover. But if an average Nigerian, the basic thing we face, the sicknesses we face, they are just malaria. I want to give birth. You get to see. I'm telling you that this 40,000 premium, you can give birth and it is covered within it. Do you know how much you pay in the hospital if your wife gives birth? It rolls in thousands. So but you can make it and save a lot of funds for other needs.
Right. Because of our time, I'd like us to pick up the pace. We're talking about health insurance. My name is Sage Babalola. Richard Anigilaje is here with us in the studio talking to us about health insurance and the things you need to know, what you need to do, and also how not so expensive the policies are compared to the information that a lot of people have, that, insurance is too expensive and I don't need to incur that debt on myself or put that financial responsibility on myself, amongst other things. So, like I said, we need to pick up the pace. So you mentioned that there are different health conditions that insurance would likely not cover, maybe because it's too much of a risk for the insurance company or whatever the reason may be. So would you like to maybe just very briefly give us an insight? What sort of severe conditions, would make an insurance company probably turn you away?
All right. I did not totally say it will not cover.
Okay.
Do you understand? It's just that you pay higher.
Oh, okay.
There are some conditions like cancer.
Right.
There are some terminal diseases that that it takes a lot to manage.
Yeah.
In fact, some sicknesses that are terminal diseases, they already know the date they are going to die. They just keep managing them till then, and it costs a lot. There are some diseases or sicknesses that you need to be on oxygen for the how much that will cost. Right. So it's not that it does not cover it. It covers, but
your premium is higher.
Extremely, and it's not all insurance companies that want to accept such, because they have to weigh their options and weigh the risk attached to it.
Right. So what are some of the considerations that the insurance company would take before allowing a person pick up a health insurance policy? For example, maybe pre-existing conditions, maybe the age factor. I just want to know, what are the things that they would ask you, questions, considerations, factors to be considered before they let you pick a policy, and would they also advise you on what policy best suits your condition? All right.
There are a lot of things to take note. First, they look at where you live.
Okay.
Because the health facility you are going to use must be very close to
you. Okay.
Where you are living in case of emergency. Then they look at your capacity, where you work. They are going to get all those information so that they will be rest assured that you can actually pay your premium.
Right.
Because in insurance terms, no premium, no cover.
It makes sense.
So aside that, they look at the totality of the package you want to go for. If you say you are going for in some forms, they try to give you a questionnaire. What is your annual income? What is just to be able to know if you can actually afford this type of policy. Then if they see that you are picking annual income that is not even up to the premium you want to pay, so they will advise you, okay, sir, can you please go for this if this is not because considering what you filled in the form, this is what we feel you can. Then if you have your business, they know that a businessman can have a lot. Then there's a certain questionnaire that will ask, what is your annual return, those type of questions will make them know the type of then there's also some questionnaires while picking to tick the type of ailments that already existed.
Okay, pre-existing
conditions. Yeah. Like, okay, do you have this? When last did you visit the hospital? Where is your next? They use that questionnaire to get information, and that will also translate into the premium you are going to pay.
Okay. So to be sure, there is no fixed premium. After they find out how much you earn, if you have a pre-existing condition, where you live, among other things, these are the things that they would use to determine how much you will pay as premium for the policy that you pick up.
Yes, there are fixed premiums.
Okay.
But if you tick those questionnaires and they are exceeding the package,
okay,
do you understand? That is when your premium will now increase.
Right.
For example, if you are taking the family plan that I cited the other time, that 40,000 annually.
Okay.
And you, in your questionnaire, you tick that
maybe somebody has a heart condition.
Okay. Definitely, you can't go for that 40,000 a year.
Right.
So you have to be advised that, sir,
you have to increase.
Yes, it will increase. So there are fixed prices.
But if there's any anomaly,
if there are other elements that are not in the package, then definitely you have to increase, or they consider, are we taking up this or not?
All right then. So what would you say about the responsiveness of Nigerians to insurance? Because that's also a concern. Like I said, there's many wrong information out there about insurance. What would you say, as an insurance expert that have spoken to a lot of people to try to pick up policies, what would you say has been their number one reason for refusing to pick up health insurance?
All right. You see, there are some misconceptions outside. Like when they hear insurance, Nigerians feel insurance does not work due to maybe experiences of some persons in the past, and all that. But when you look at it, most of these people that key into this false misconceptions, they feel since this person said this, definitely that is how it is. Seeing is believing. If you have not actually assessed this, then you should not be able to spread fake news. Insurance is very cheap all over the world compared to the benefit you are going to get. If you get to property insurance too, the amount you get as a benefit if anything happens to your property is higher than the premium you pay actually. But people look at it, what if something did not happen to me? Then my money is gone, But right. What if something happens? So most people, they look at it, what if I didn't fall sick? I'm the type of person that I don't fall sick. But you see, we are not wood. Even wood at times, they break. So you look at it, be on the safe side, a win-win scenario for you. If you pick up the policy, you know that if anything happens to me, I don't have to rush. Do you know that there are times that people fall sick and that moment they have nothing in their pocket? They start looking at that, and those are the things that kills people most. Because when you go to a private or even public facility, health facility, and you have to pay money, and if there's no money, in most cases they don't attend to them. They will tell you, please deposit so amount when the money is not there at that moment. So what do you do? An example of somebody that is driving. If you are driving, you have an extra tire. Are you praying for an accident? No. You are having it in case something happens. And if anything does not happen, a win-win for you. So the same thing, I want to advise all Nigerians. Insurance is key. In fact, in the developed countries, you can't access health facilities without insurance because it's expensive. People that are jackpotting, traveling, compulsorily, you must have health insurance before you leave, because they don't want you to get there and be a liability to their health facility. So they pay hugely for the health insurance before leaving. So that is where things work. Until when Nigerians see this as a need and not luxury, or a type of condition that I will use in accepting a job offer, you should know that this is basic. It is one of the things that I have to plan with my family, with myself.
Right. Speaking about as a condition for a job offer, I do know that there are certain jobs that you would not be granted if you do not present a health insurance. They would not employ you. What sort of jobs are those? Because I am aware that when you apply for a job, they would ask you as one of the requirements, the way they're asking for your CV and other things, do you have health insurance? Although some organizations will provide you with that cover, but then there are possibilities of certain jobs asking that you show them that you have insurance before they hire you. Right.
Yes, those type of jobs are jobs that are
high risk.
High risk jobs. Like there are some type of situations like going to the war front, reporting. All those type of high risk jobs. You must have health insurance before you can. They can grant you such. But in most cases, especially those type of high risk jobs, are for the international community.
Right.
But in the local Nigeria, the companies actually provides because it is in the law that every company that has more than 4-5 workers should have health insurance for their workers.
Right.
Yes.
So that it will be deducted from the emolument of
yes.
It's not like it's the company that will bear the cost.
Yes.
Of course, they might contribute, but deductions would also be made.
Deductions will be made.
The individual,
but on both parts.
Okay, so both the employer and the employee would pay for the health insurance. Okay, so let's talk about duration of insurance cover and also the renewal process. I know that, like you said, one of the things that cause apprehensiveness, if that's the word, why people don't want to pick up the policies, because after the year, if nothing happens to me, that means my money has wasted. I'll not start paying money for something that didn't happen to me. So let's talk about that. First things first, an insurance policy, does it cover you for 2 months, 3 months, a year? What exactly is the duration of cover like? And in the event that nothing happens and an individual wants to renew the policy, what is that procedure like?
All right. For example, if you are taking up an insurance policy now, the procedure is very, very easy. For the first time, what you need is to fill the forms, like I said. Let them get your details. Then you pick the package that you are going for. Then you make your payment. The policy document will be issued to you, stating that you have an agreement with us, mostly HMOs, health maintenance organizations. That's the meaning. After doing that, the duration is always a year.
Okay.
But like I said, I cited an example of the Lagos State stuff, which enables you to pay monthly, quarterly, or semi-annually, then annually. But do you know, if you pay monthly, if something happens to you a day after the
expiration
of the amount you've paid, you're not covered. So in most cases, insurance policies, we advise that you pay annually. Because annually, before the other year comes in, you are already planning to pay, or you might have paid. Then it makes it easier.
So there's
for
no
you.
gap.
There's no gap. But when you divide it in quarterly, it makes the gap very short, and you may find it difficult. But if you have paid annually now, then it makes it easier for you to assess it. Then renewing it is very easy. You have a date that your policy elapses. Then on that date, before that date, you might have paid. Immediately you pay, then your policy starts running again. You don't need to fill any form again, except you are adding another information.
Okay, maybe the person comes down with say when you pick the policy, first things first, you're not going through any life-threatening medical condition, right?
Yes.
You're just covering yourself in the eventuality that something happens.
Yes.
Say before the expiration of your initial policy, say the person comes up with a cardiac situation, or the person has cancer.
Yes.
When in the renewal process, that would mean they would have to reconsider your premium and other things. Is that how it works?
Yes. Then, for example, again, if you pick up a family plan,
Okay.
now, and you guys are just your wife and maybe one child,
and then you give
and
birth.
you give birth within the year. If you are renewing,
okay,
or even before you renew, you can approach them that, look at what happened.
Okay.
I already have another member.
Okay.
So I want to add the member to the family, which will now increase. But like the family plan, I said father, mother, and 4 children. You
okay,
understand?
so 4 children.
So you have one before.
Okay.
You already have advantage of 4. You have one before, and you give birth. You don't need to approach them for another.
But once it exceeds 4,
then
adjustments.
yes, you have one, and your wife gives birth to like 5. Then you are going to approach them, except you want to leave one out of them.
All right. We'll also come to the end of this conversation, but Richard, speak generally, right? Let me call it final words, really. Say you want to push the agenda of adopting insurance in the country. You're speaking to us now one-on-one as an insurance expert, and you're trying to get us to, obey the law, first of all, that insurance is important. What exactly would you tell us and everybody listening?
All right, Lagosians, Nigerians, insurance is key to everything you do, especially your health. Health is wealth. It is when you are healthy, that is when you can pursue other business of life. So it is law that you must have health insurance. You don't have to be a liability onto your family. You don't have to run helter-skelter when the need to get a treatment comes in. So I want to employ you. Please go to the nearest HMOs. Meet health insurance experts. Tell them that you need to get an insurance cover on your family, because when you are covered, that is when the prosperity comes in for each and every member of the family. When there is no good health, then there's nothing to show off for your achievement. So please obey the law. Pick up health insurance scheme today, and I assure you that you will never regret it, because you, at the end of the day, you see that you have saved a lot. Like me, I can access my health facility like 20 times in a year. because I want to use my money. If I just have headache, please, doctor,
Yeah.
I just bring it. Okay, they will examine you.
Stomach is
Do everything.
telling me
Yes.
to go to the-
So
Right.
you know, you have
Peace of
this
mind.
peace of mind
Right.
that you don't need to where do you get money? No. So you use it, and if you don't use it, at the end of the day, we don't pray that we fall sick.
Right.
It's still a win-win for you, because you can't quantify the amount you can pay for good health.
Right. Thank you very much, Richard and Ngelaji, for joining us. It's such a pleasure to have you. Thank you for informing us. Well, I hope that you've heard, and not just hearing, you're going to put into action, give expression to what you've heard today. Insurance is important. Health insurance is important. This is a health show. That's why we cannot, broaden the horizon and talk about insurance in its totality. So we're limited to talking about health insurance because this is health plus. But then again, insurance in the general sense of it is very, very, very important. Anything can happen to you. And when it happens, are you protected? So this is just about protecting yourself, protecting your family, and protecting those that you care about. And like I said, you know how expensive healthcare in Nigeria has become at this time. So lots of people who would just allow themselves to, go through the terrible health conditions, they start to self-medicate because they cannot afford it. But imagine paying as little as 6,000 naira, and at the end of the day, if you're going through a health condition, you can easily approach a healthcare facility and you're taken care of. It's something good. So let's do what is best for each other and obey the law, because apparently Richard has told us now that we are all committing crime against the law because we don't have. If you don't have, I will not admit whether or not. It's nobody's business.
Don't let me charge you.
Of course. Please, let's take care of ourselves. Again, Richard, thank you so much for being here. Hopefully we get to speak to you more, because I'm sure there's always evolution of these policies. There are also always changes and additions. So as new information comes about health insurance in the country, we would like to have you join us to talk about it. Well, that is it for Health Plus for today. Thank you so much for participating. Until next week, Friday, of course, I'll be here, Stage Babalola, on Mainland 98.3 FM to talk to you about everything health on Mainland 98.3 FM. Also, please be reminded, we are going to be having a conversation today on Twitter, or if you like X, by 7:30 p.m. We're going to be having a conversation with ʟᴜᴜᴜ as the moderator, is the head of our political desk. We're going to be talking about Nigeria beyond oil. We want to tell you about the other sectors of our economy that we can explore, that we can harness to ensure economic growth. So aside from oil as a resource in the country, what else do we have that can translate to revenue for us in the country? So join us on Twitter or X today on Mainland FM. That's at Mainland FM, I beg your pardon, at Mainland FM on Twitter or X, whichever you like, 7:30 p.m. and join that conversation. Let's hear what you have to say. Sage is my name. This is Mainland 98.3 FM. Please stay with us.